Hi guys, it's Alicia from TSAT Accounting Solutions. We're here today to talk with Dr. K about some of the services that he can offer us and go over some of the things that he does at Free Market Physician. So I'll let him take it away.
Yeah, thanks. Myself, Dr. K, and I would like to thank you guys, TSAT team, for having an opportunity for me to kind of talk about our services. So we are Free Market Physicians. It's a clinic, a primary care clinic, and it's a member-based plan. It's where any patient can pay a monthly fee, and basically it's like a member. You join a gym club or any kind of clubs, and you're a member, and you are in and out, and you get access 24/7. If we have the same concept, we don't have like 27 in and out, but basically it means you can see the doctor no matter how many times in a month. It's all included in the membership fee. Also, they can get access to me, like personal cell phone, because I believe things always happen after hours or during the holidays or weekends. So I believe our members should be get prioritized on this time. So the members can reach out to me. You can call me, text me, or even email to ask me questions if you have any issues going on or any kind of recent acute infections, things of those nature. Besides that, we also dispense medication in-house, which is like a reduced pricing. But we also do labs at a wholesale price, which is like almost like 80% less than a regular. You go to private labs, 80% reduced mark, of course. On top of that, our member also get a benefit of, like, we also do in-office procedures. That could be anywhere from as simple as mole removal or skin tag removals, joint injections for elderly people. We do breathing treatment, incisions, stitches, you name it. We do all the minor procedures. We don't do major stuff. It was funny when one of my patients asked, like, do you remove or do you fix broken bones or kind of orthopedic surgeon kind of things, or do you remove like gallbladder or kidney stone? Like, I wish I can, I'm just a primary doctor. We don't have those equipments. I know we're trying to save money, but that's not my expertise. We usually refer those patients to specialists, be it orthopedic or surgeons or anywhere you want. It's deemed necessary. We just refer them to a major hospital system or private, private practice specialist. Once they get a referral from our clinic, pretty much they know if they don't have insurance most of the time, so they get the reduced pricing already once they get the referral. So there are lots of ways we can save money for the patient. Plus, we provide better health care. So I guess in an nutshell, that's how we are, like member based, getting in and out, see me unlimited times, no co-pays. The good thing about our clinic is, any members or most of our members are working 8 to 5. And the good thing about our services is they can reach out to me and call me, text me, without even having to leave their office. So they don't have to take the days off or half day off to be seen by a doctor or something like that. And we can always call them. So, and the other thing is if needed, like in person, we can. We almost always see on time. So meaning if you appointment at 2 o'clock, you'll be seeing me at 2 o'clock. It's really we really strive hard to kind of have that promise, like on time thing. We might have delay maybe 5 or 10 minutes, but that should be the max kind of thing. And that has really helped most of our patients to just take like a small lunch break, and they in and out, be seen, and go back to work. They don't have to take a whole day off. And one more important thing is we spend most of our time with the patient, not billing insurance because that's not what we do. So we spend more time with the patient, like almost 30 minutes with the patient. So our appointment is blocked 30 minutes each time for the patient to see. We can extend to an hour if needed based on the needs, but it's always like 30 minutes. So it's not like a rush, just a couple of questions and go to the next patient. I never do that. That gives them, both the patient and the doctor time to sit down and answer all the questions. And from my side, to better know the patient, their whole history, all this kind of stuff. So that's all we do. I gave you a list of services for in terms of labs and medication prices. So the bottom one is the medication price. If you are not familiar with the pricing of the name of the medication, but those are most commonly used for blood pressure, cholesterol, antibiotics, and all this kind of stuff. And as you can see, some of those medications are less than $1 for a 30-year supply. That's the way we work. That's kind of not so what we do. Any questions?
So I kind of have one. So you have $70 a month. Is you sign a contract for like a whole year, and it's a month-to-month basis that you pay, or is it?
We signed a contract for whole life.
For whole life. Oh.
Just kidding.
Figure out, yeah.
we signed a contract for a year, but it's not like a hard and fast rule. We're not stringent on the contract. We can break the contract as simple as text like, hey, I'm moving. People move, they find new jobs, they get married, they get insurance from their spouses, things happen, things change, they lost a job or something happens. So we always just a text away or call away. Just let me know and we'll stop the membership. So that's easy that would be.
On the member pricing, is that vary? I mean, you've got $70 here. Would it matter of age or history, health history, or anything else? Is that going to affect that monthly price?
Not yes, for the age. If you're under 18, it will be $30.
Sure.
But after 18, it's going to be $7, no matter.
Okay.
Healthy 15 medications or 100 different diagnoses, it's still going to be $7. And by the way, we don't, screen patients based on,
sure.
health history.
Okay. Do you also offer physicals?
You mean physical, like a physical exam?
Mm-hmm.
Or?
Yeah, like there are jobs, or there's, for example, I'm a scuba diver. I have to have physicals that I turn in once a year so that when I travel and go to different places, I have to prove that, my doctor says it's still okay for me to scuba dive. Do you guys offer anything like that, or?
So physical, it depends. If it's just like a physical exam,
mm-hmm.
that's we do, and it's included in the membership.
Okay.
You don't have to pay any dollar on that. But if it includes like employment history, because most of them require drug screening,
mm-hmm.
we can do UA, but not drug screening and all the blood work. We can also do blood work because all we need is just to kind of type the name of the blood work. But specifically, like drug screening and drug-related screenings, we don't do those things. We can refer them to Quest or simply just to somebody else. Yeah.
Awesome.
Do you guys have a free market physician business plan?
Yes, we do. Yeah, I'm glad that you asked. Yes, we do. So that the pricing that you have is 70 and 30 is for individuals or normal any families or anyone. So we understand that running a business is pretty hectic, it's pretty stressful financially, and the business owner wants to provide some benefit for the employees, and it's always a struggle for the marketplace. So we kind of appreciate them, and we offer them a business plan. There's a discounted rate then versus so basically a business plan would be for the adults it's going to be $60 and under 18 to 25. So that's kind of discounted. It doesn't seem a lot, but when you do the math, you're saving $10 per month, a whole year. It's $120. So basically, your 2 months is already paid off. So we also have a special pricing for the family. A family of 4, mom, dad, and 2 kids, it's going to be flat 200. So any more children or any more kids over 2, that's kind of paid off because 70 is 140, 2 kids 30, 60 is 200. That's a cap. And if someone have more than 2 kids, there is a cap of $200. So basically, I encourage my patients to have more kids. So more kids, more benefit. I think we have so far. My patient, there's a mom and dad and 3 kids, and $200. Yep. So I think for same thing goes with the businesses as well. You can still add your family members, your spouse, or your kids, all this kind of stuff.
On the business plan, is there a minimum amount of employees that have to sign up with that, or is that just per business?
We initially thought we would have a business of minimum number of employees, but over time we figured out that most of the business owners currently in town have less than 10, or maybe in the range of maybe that's husband and wife, or husband, dad and son, or 2 brothers, something like that. So as long as it's a business name, we don't really make a difference in number of employees.
Okay. And do you guys travel outside of Joplin to help people, or is it just inside of Joplin?
So the number one thing is we don't travel. Okay. I love to travel.
Okay. Well, I thought you said that you went to people's offices, so I kind of assumed that.
We have 2 locations in Neosho and Joplin. So my patient can travel to the locations. So if I'm off or I'm on vacations, if it's something like text-wise, I can still handle that. If it's in-person needed kind of things, then they can go to Neosho. It's just since the same name, get all the benefits the same. Now, travel-wise, you're trying to ask me about in-person, like a house call or something like that. Unfortunately, we don't do those things. I know some doctors, who's doing similar, they do some chiropractic, physical therapy, they do in-person, or they visit their house or office, something like that. Unfortunately, we haven't gone that far. We have reached out in the community to get the shots in Neosho. We went out and after hours we get injections. I think there were some breakouts, and then we just had to give 200 vaccines and day 1. And we did that with the pharmacist, who were a team of 3, and then nurse helping. So we had to give that 200 people vaccines that day. So that's what we did so far in terms of community. Yeah.
How many physicians do you have?
So in Joplin, I'm the only one.
Okay.
So far, we're planning to add 1 next year. So that's a future plan. But we have two physicians in New York. So yeah. We have 1 more. But she's like a PRN, I think. She works in Mount Vernon, and she comes to New York clinic when needed, but it's not like a regular thing. 3 full-time doctors so far.
That's awesome.
Any questions?
I have kind of I don't know if it's necessarily a question or more if it's you can tell me yes or no. I have a younger brother who he lives in Kansas, and he's got asthma really bad, and he can't afford to go to a doctor there. So if I have him come to your guys' clinic, you would be able to help him with getting a albuterol and all the inhalers and all of that stuff.
Yeah.
So it doesn't matter that he's from there coming here.
Yeah.
I assume.
Yes. That brings a good questions about the state boundary, and I get that questions
Your
a lot.
territory.
So like, are you bounded to the state? Yes, I am, but not restriction for the. As long as the patient is walking through my office, it kind of says that it's in Missouri. So we have many patients, especially in New York office. Many people work from Arkansas. They drive to New York, work there, and then go back to Arkansas. So during the time of work, if something happens, they have to be seen. So New York is the stop for the clinics. On our side, we have many from Pittsburgh, Baxter. We don't have anyone from Oklahoma, but yeah. So they are still my patients. They drive and then see me, and yeah, there is a restriction there. That was a good question.
I know you said that a lot of your patients don't have insurance, but do you guys take any kind of insurance, or is that just something that you guys just avoid?
So we, to answer that question, we don't take any insurance. Yes, we don't take any insurance. I guess that kind of answers the first thing. So here's how we work for someone who already has insurance. I mean, for someone who does not have insurance, it's kind of a better option for them to have. Now, for someone who have insurance, it's kind of falls tricky because now it's like, okay, I have insurance. Why should I still use you? Or someone who did not have insurance before, and they were my patient. Now they switch job. Now they have a plan. They still want to be with me. How that things or transition goes. So here's how we have normally worked in the past. Is So for first case scenario, like they didn't have they had job, they didn't have insurance, they had free market physician. Now they changed job or got better salary. Now they can afford insurance. They have insurance. They're still using us because they know that the type of care we provide is not going to go anywhere else. They know, for instance, they want to call their primary doctor and to be seen, and the next appointment is 4 weeks from now, which is like, I am sick now, what's going to do 4 weeks from now? Probably I'm going to be healthy at that point. I need someone right now or medications right now. So that's the reason they still stick with us. The other thing I tell my patient is use any kind of insurance you can have, like high deductible or catastrophic plan, or something that can cover for major medical. So if you have insurance, great. Or if your company provides insurance, that's great. But do the math, deductible, out of pocket. If you do that, or if you know that number, you'll be better off using free market physician, because the best of the best plan in town, I think you can get is like 1,500 to 2,000 deductible. And most people don't realize they have that deductible until they go to an ER or they go to a surgery and they say, oh, I have insurance, everything should be covered. And 3 months later, they're going to say you have a 5,000 due because you didn't make your deductible. And that point they realize, oh, I have a deductible. And most people, they have insurance and they don't know what the word means, deductible, what does it mean co-pays, what it means co-insurance or out of pocket, until they have to pay it. So yeah, I think lots of my time with my patient goes with educating them about health insurance as well. I'm not a broker, I'm not a health insurance guy, but those are really confusing terms for most common people. So, yep. Any more questions?
I don't think I have any more questions.
It's a lot of. What? Go ahead. No, I was just saying it's a lot of information. I just.
Yeah. I'm more than happy to
I
help.
appreciate all of it.
No problem.
So we appreciate Dr. K and his presentation. TSAT is super excited to work with Dr. K, and we just want to say thank you to everyone watching this video. We hope that this helps you in the future. If you need more information, don't hesitate to call Dr. K at 417-208-2293. Or if you're in the office and you were just wanting to talk about something, just let us know. We can help you out. I hope you have a wonderful day. Thank you.
Okay.